Relationships. Excellent relationships are critical to trying to work together to improve the services for the patients of Gateshead. I want to tell you about some of the relationships we have within Gateshead Clinical Commissioning Group. Our organisation is clinically led, meaning that clinicians are at the heart of our team, but they work with a highly set of skilled managers and admin staff who help do a lot of the work. The organisation is overseen by a board of clinical representatives from each practice, and these make the ultimate decision makings about big issues, but they only meet a few times a year. They delegate the governance, i.e. the running of our organisation, to our governing body, who work on behalf of practices. Now this has 2 lay members, a consultant, a nurse, and our senior clinicians, and the senior management team, and these meet frequently. Our senior team of clinicians and managers do the day-to-day decision making through our executive team. And our work programme is led by more than 10 clinical leads and covers the areas set out in our plan. For example, we have a GP from a local practice leading urgent care, who works with a management team to improve our local services. Now, more information will be available about the governing body, including minutes, meeting dates, and these will all be held in public. Our commissioning plan and these details will all be available on our website. We mentioned in our vision section that a lot of our patients use Newcastle services. We therefore got a lot in common with our Newcastle CCGs, in whom we formed an alliance, and this means that we can be working together as an alliance of 3 CCGs, giving us more influence over the difficult problems and making us more efficient to use our taxpayers' money. We also want to work closely with our local authorities, of which clearly in our alliance area there are 2 local authorities who already were working together on some areas. But each CCG wants to work in its one locality to address local issues, but we can still share resources on how we do that so we can get more for our communities, and we can work together on difficult challenges so we can have a common approach to our different localities so we can get better results. Clearly, it's really important that we work in our local area, and our local authority, Gateshead Council, are critical to delivering that for our patients in Gateshead. Together with them, we jointly assess our community's needs. We jointly plan for Gateshead at our Health and Wellbeing Board, which has got a number of different work streams. We jointly organise and commission for some services, such as the work we're starting to do with children's services. And we jointly ensure that we've got safe systems for adults and children where people are employed across the CCG and the council as one team. So there are many different relationships that are important across our geography. Clearly our alliance with the 2 Newcastle CCGs is critical. Our work with Gateshead Council, particularly through the Health and Wellbeing Board, is really important. Our staff are mainly employed by North East Commissioning Support Unit, and we have a close relationship with our local area team through the Commissioning Board. Many other people help us commission services, and many other people help us provide the services of Gateshead. These are just a few of those providers and those other people that help us deliver the best healthcare that we can for our patients in Gateshead.